there is a restlessness that the person with dementia will develop, and they will keep on walking out, or they will keep on going out of house. So, and they will always say, I want to go home. So that is wandering. There's perseverance where they will keep on repeating. There's aggression, lack of inhibition. There's a social inappropriate behavior. They hide, because there's so much short-term memory loss. They hide things or they lose things, and then there is a blaming towards other. A very complex and interesting symptom is sundowning. As the sun starts to set down, a lot of people with dementia will have a lot of anxiety, restlessness, and then starts that I want to go home. So these are the behavioral and psychological symptoms. In a lot of cases, medical support helps, but other than that, there are non-pharma therapies like all these things that are mentioned over here, starting with cognitive stimulation, which is brain activity, and other therapies like reminiscence therapy, pet therapy, music therapy, art therapy, speech therapy. All this will help them at least to cut down the challenging behavior, to slow down the progression, and it will provide social support. It will give, like, all these behavioral interventions will help to calm the person. Dementia span. It's different. So each of these diseases that we talked about, Alzheimer's, frontotemporal, vascular, they will have a different span of disease, or different lifespan after the diagnosis is done. And in that particular span, we can divide it mainly into 3 stages, which is early stage, middle stage, and late stage. So in early stages, as the word sounds, they will have mild problems like memory loss, difficulty thinking around language, poor orientation, visual issues, then mood and emotional changes. In middle stage, or what I would call moderate to severe stage, it is very noticeable symptom, and this is the point where we actually get to see a lot of people, because families have a lot of issues in the moderate to severe stage, because the symptoms are so noticeable and they are hindering not only for the person with dementia but for the entire family. And that's the time, unfortunately, that's the time most of the families will come either for a diagnosis or for some support. Eventually, it should be ideally, it should be a early diagnosis, because that's the time where we can do a lot of intervention, and the caregiver will also have a lot of time to understand. Whereas when people come in middle stage or in severe stage, it gets really very difficult, even for the service providers also. So one thing why we are talking so much about dementia, so that we get early stages, so that people get early diagnosis. So coming back to middle stage, understanding of the middle stage of dementia, it will have a lot of behavioral issues. So ideally, if for the diagnosis, if a person has started with a neuro support or from a neurologist, ideally in this stage, they would need a lot of psychiatric help and psychiatric medications, because there's a very high behavior and psychological symptoms in dementia. And these are so high that even the family is not able to manage at home. This is the time when they need a lot of additional support, like support what we are providing, or paid carers, or like assisted living. Then comes the late stage. Middle stage can be something around 2 to 4 years, depending on the type of the disease. And then the late stage is mainly where there is a complete memory loss. Only the autobiographical memory is remained, or they will have very basic memory. The language, communication, it's absolutely impaired, and there is not much communication other than like 1 or 2 sentences, loss of motor skills. That means like there is a complete dependency on the other person or on the carer for every little thing, from eating, from going to the bathroom, or any basic thing, and imagine how complex it can get. You want to go to, like, say, a person with dementia wants to simply want to walk out and go in the garden, but they are not able to communicate, but they want other people to understand you. What happens that because there is just no communication, verbal or even non-verbal, they will get very restless. They will get that boredom, and then that can cause more of the behavioral or psychological issues. So as the stages also increases, the complexity of the whole thing also increases. As it sounds late stage, eventually it will be end of life care, which is more like palliative care that will be needed. So the person will have, like, loss of swallowing, loss of motor skills, but the body also starts forgetting the functions. So loss of recognition of familiar people, where they are not even like able to recognize spouses. So that's the cruelty of this disease, unfortunately. But I think it is very important for us to understand the depth of what happens in dementia. And as the last point says, that end of life care. End of life care can also be a good span. For some people, it could be a couple of months. For some people, it could be 2 to 3 years also. So when we are talking about all this care, it is financially also a big issue for the family. First, they have to provide everything, like from the care, maybe a tender at home, maybe nurse at home, and then this is like we're talking about. It's not like we're talking about years. So early stage could be like 2 to 3 years, then middle stage could be 2 to 4 years, and then it could be again late stage. So it all piles up to approx 5 to 6 years on average. But as I said, the diseases, based on the diseases, the span can change. So I just mentioned about behavioral and psychological symptoms of dementia. This generally happens in the very second stage, or moderate to severe stage. So as it's a neuropsychological issue, there are a lot of agitation, hallucinations, depression, delusion. These are the things that happen. But in dementia, there are a lot more of these behavior issues other than the neuropsychological challenges. There's something called wandering. So there is so what exactly is cognitive stimulation? It is nothing but brain exercise. It is meaningful activities based on the person. So we incorporate something called person-centered care, which is a holistic approach where you understand the person, you understand their culture, their background, their from what professions they are coming from, and based on that, then you give them, and of course the current abilities due to dementia, then you provide them these cognitive stimulation or brain activities. So it basically helps to slow down the progression of dementia. It gives positive feelings. It helps in verbal and non-verbal communication. It maintains, it helps to maintain their independence and daily abilities. It improves the confidence in the person. It helps to manage these challenging behaviors, which we spoke about just now. And eventually, it improves the quality of life of the person with dementia and also the family person. So, why are we talking so much about dementia? One thing I feel that we never think that dementia can happen to us or dementia can happen in our family. It should never, it should never happen, but we never think like that. So a reality check is that India has about 8.8 million people living with dementia currently. This was a study published in 2022 from Delhi AIMS. So they are quoting 8.8 million people. That's a huge, huge number. Sadly, in India or a lower middle income country like India, we have only 10% of this number which ever gets a diagnosis, treatment, or care. And to remind you again, the Hyderabad survey said that there are more than 50,000 people. That number, I take it personally, that it has doubled by now. So where are these people? What is exactly happening? They are mostly taken care at home. We have very few services or centers for dementia. Why? we have a very low awareness of dementia. There is generally a lot of stigma associated, which eventually delays the diagnosis. Nobody will take a 60-plus-year-old to a doctor saying that, oh, because they are just blaming me that I didn't give them breakfast, or they are just misplacing things. So we don't know what is dementia, and that is delaying us from the diagnosis. There are very few memory clinics and services, as I just mentioned. There are lack of dementia specialized professional in the country. Then it is out of pocket expenditure. Predominantly, the family provides the long term care. So, the long term care, we just saw the span of the disease. It could be 5 years, 10 years, and it is all out of the family's expense. There is an insufficient number of long term care in the country. And as I said, there is only 10% of the actual. So, recently, last year, they have quoted a number which is like 35,000. That is, you can see it is 3,500 crores. So that's a huge number actually. That is the cost, societal cost in India. I remember in US, they quoted to $1 trillion industry for dementia care. So, it is a hidden pandemic that we are not talking about. Give you a little more insight. You can see on the picture, on the slide, this is the 8.8 million people, and the services that we have got is less than 1,000. I was part of a report for Dementia India, and that was to be submitted for the government. So I can quote it very well. The number less than 1,000 is a very neutral number that we have quoted over here. It's actually less than 50. So imagine having less than 50 daycare, less than 50 residential care, and very, very few memory cares for the 8.8 million people. So we have a huge burden, but we don't have services. Why? Because we don't have a lot of awareness also. Not a lot of people know about it. And by this, one of these, like how WishwaTalks is helping us for this platform, this is a way we are trying our best to reach out to people. So as a normal public or a general public, as you and me sitting here and listening to it, how can we prevent dementia? Studies says that there are 40% of these cases that can be prevented by addressing these lifestyle modification factors. So the Lancet study has published that there are lifestyle modifications that will help by 40%. So what do we do? What do you and I should do? See, if you go to any doctor, they will say the same thing. They'll say exercise regularly, adopt a healthy diet, take time to de-stress yourself, get sufficient sleep. Also, the Lancet study says that increase your education, learn new language, have physical activity. Generally in our culture, we would say that, oh, I'm already 40 and 50. Why should I go run, jog and all? This is not my age. This is a very, very cultural based bias. We need to come out of it and actually start thinking that age is just a number, and what we do right now matters a lot that will happen to us down the line. So there are a lot of studies that say that dementia just shows the symptom after the 60s, whereas dementia actually sets in 30s and 40s. A very recent study also says that inactivity in young children can cause dementia in younger age. So we need to be very careful of what we are doing, what sort of lifestyle we have right now. I think adopting all these good lifestyle habits will help us to prevent dementia. Eventually, it is to control your diabetes, hypertension, control obesity, smoking, mental health, exercise regularly, control the alcohol intake, wear helmets, please. Head injury can be a major reason for dementia. And of course, the environment we live in. So we can prevent dementia. Yes. Risk factors. I think I have just gone through the risk factors. These are the 12 risk factors published by WHO that can help us to prevent dementia. So, ARDSI. What is ARDSI? ARDSI, who are we? We are Alzheimer's and Related Disorders Society of India. We were established in 2008, and since then, we've been campaigning for dementia in Hyderabad. So there are a couple of services that we provide, and I would like to highlight a little bit on that. So to think about, like, the care pathway, what should a person do if they have identified warning signs? They need to go to a doctor. So we run a memory clinic where we provide a paper pen tests, neuropsychological assessments, and which helps in diagnosis, treatment, and counseling. So you need to reach out to memory clinics. Most of the hospitals will have memory clinics, or this is an example of the one we provide. We also do monthly caregivers meeting, that is a support for the family. So every month we will do either a webinar or in person, where we try to do a theme based meeting to make people understand how to manage symptoms or all the other challenges that they are facing. And we also have quite a huge network of family caregivers, and our motto is to help them as best as we can. Dementia daycare. So dementia daycare is based on person-centered approach, which is a holistic approach in dementia care, where we provide cognitive stimulation, physical activities, caregiver support as respite, where the patient can spend the whole day at our center. And we do a lot of therapies, like I mentioned, like reminiscence, pet therapy, aromatherapy, all that will help them to slow down the progression of dementia. We also run something called virtual cognitive stimulation program for people who are not able to come to the center. We provide home visits for the families or for the person who's living at home, where we try to understand their environment, and then we suggest what improvements or what modifications should be done for the freedom or for the person with dementia, so that it doesn't affect their day-to-day life, as the abilities are not helping or are not are disturbing them for the activities of daily living. Then we have dementia care training. So we are affiliated with Alzheimer's Disease International, which has a headquarters in London. And through ADI, we provide dementia care skills training, which is a DCS program for paid attenders or caregivers or dementia professionals or other medical professionals. We also do student internships, where we have a lot of college students coming and doing internship programs with us. We are also part of research and literature, where we have published quite some research, especially for the COVID and dementia. And so we have already published 2 of them, and the third one is in pipeline. So we are actively into research. We participate in a lot of international conferences. We run this helpline, which we call it ZBCHA. It's a WhatsApp group, and by now there are some 200 participants, which means like 200 families. So they get a constant support over this WhatsApp platform. There are a lot of stakeholders like dementia experts, doctors, psychologists, who are available online to help and support the family caregiver for their queries related to dementia care. We advocate, and we have launched this campaign, which is called Dementia Friendly Communities Hyderabad, where we do a lot of dementia awareness, like going to gated communities or medical college or other colleges, schools, and other platforms where it will be like elder care or senior citizen forum. And we try to do dementia awareness so that more and more people are aware of dementia and they try to get the early diagnosis. Advocacy, we've been trying to reach out to the local authorities and government so that we can have at least the state level policy for dementia. And we've been trying for some time. There are networks that we have collaborated with. So you can be part of us. You can definitely try to help us in dementia-friendly communities. You can help us for the awareness, help us to, reach out to the right person, network and partnership. You can be a volunteer. You can help us with donations or raise funds. You can help overall, because as you see that there is so much need for dementia care in our community. The numbers are so high, whereas the services are so less. So I request you all to come forward and help us in every possible way, or help the dementia person know, or at least the families know that, they need a diagnosis. It's a medical issue. It is not just like a normal aging. So these are some of the events that we did recently as part of our awareness drive and campaign. So we have been to rural areas where we did memory screening camps. We have been to gated communities for these screening camps so that people get early diagnosis. We have done a memory walk. We have done, basically, we are available for any platform where there is an audience to listen to us and to, because eventually it will help one and all to know what is dementia and what are the services available. So thank you so much. Thank you, Vishwa Talks and the team, for this opportunity. And I'm happy to take the questions from the audience.